Dr. Blue, the landscape of myeloma care has changed significantly in recent years. Are there new factors to consider when working with a patient to choose a treatment approach?
Yeah, the good thing about myeloma is that it's literally always changing, and that's a great thing. Compared to some of the other cancers or really even other diseases, sometimes we've been using the same things since the 90s. But luckily for myeloma, every couple of years we get something that's bigger and typically better. So right now, some of the new things that are available for patients are all the way from newly diagnosed all the way to people who have relapse disease. So we have a lot of different options that we can potentially go into.
Dr. Blue, what treatment options are available for myeloma that's considered high risk?
Yeah, so unfortunately, there's some people who have multiple myeloma whose disease does not follow the standard pattern. Unfortunately, what happens is that there's certain mutations that actually happen in the biology of those cancer cells that actually cause them to survive when they should be dying. And unfortunately, that means that sometimes the chemotherapy and the medicines that we give them becomes a little bit more resistant. A lot of times when we give people treatment, the one question they ask is, how long will it last? But unfortunately, there's some people who have those high risk features that unfortunately, despite whatever numbers we tell them or how long it may last, theirs actually may last a little bit shorter and the disease may come back a little bit quicker.
Mm.
So what we have to do as the doctors and as the team taking care of these patients is maybe do things a little bit more outside of the box and do things that might tend to be a little bit more aggressive, because sometimes we have to match the aggressiveness of the disease. If the cancer itself is starting to be high risk or aggressive, sometimes we may have to do some non-traditional things to kind of make sure that they have a good outcome and a good result.
Dr. Blue, is there developing research that myeloma patients should know about? And what are you hopeful about?
Yeah, one of the things that happens right now is that we have CAR T that's available for patients that got approved by the FDA. However, the CAR T product that we currently have available only have one target, which is called the BCMA or B cell maturating antigen, which is part of the plasma cells. However, there's so many other targets on the plasma cells that potentially can be targets for new medications. And the good thing is that there's actually new CAR T and medications that are being developed that actually target other things other than the BCMA. So then it may come to the point where people get more than one CAR T down the road. And I think those are exciting clinical trials, because if there's multiple targets and there's multiple CAR T, maybe we can sequence them in a way that maybe we find a cure for this disease one day.
That's exciting.
It is.
Dr. Blue, thank you so much for joining us. Do you have anything else you'd like to mention?
I just want people to know that it's okay to get a second opinion. I think that, regardless of what's happening in your care, sometimes it's always good just to have someone, especially someone who's what they call a myeloma specialist, to review your case and just make sure that you're on the right road and that things are going well for you. So, it's something that I would recommend for anyone to do.